Hi friends, Dr. Lona here, and I wanted to do a little recording or maybe a longer recording on the concepts and the help and advice that it sometimes takes to move forward with breastfeeding and, have a successful go at it for however long that is between you and your baby. So I think it's important to know, like from the vantage point I speak on, of course, from being a chiropractor and loving the holistic end of things, we're always encouraging moms and women who are intending to become moms that, if there's any way to have a more natural birth and then encourage the concept of thinking about breastfeeding and really entertaining it, even if you'd never thought about it before, it's definitely a worthy thing to entertain and to get some support around. And so the reason I say that is so many layers to that for both mom and baby, but certainly first and foremost that for baby, it's one of the only ways that they're growing their immune system to begin with. And the support of the mother's immune system is so important in those beginning months while the baby's really growing their own and maybe doesn't have all the ability to fight that they will in a few months. And so being able to get that direct connection from mom, whose body knows how to make the perfect elixir of life that it does for that specific baby is just like such a gift to give your child if you're able to. And so that's, of course, why we first and foremost, definitely encourage it. Second of all, also, it's such a great bonding time. There's so many hormones involved for both baby and mom that bonds them that, if we think about animals, a lot of times as humans, we don't think of ourselves in that way, but we certainly are. And the close body connection, the bonding that happens, I think that is just so important for healthy bonds from the get-go for both mom and baby. So I just can't say enough about how important I think if you are able to breastfeed, being encouraged to do so, even for a short period of time, it's a worthy cause. So in my own experience, I have two boys and I've done extended breastfeeding with both. So my son, Jack, who's my oldest, he nursed until about 4. And then I'm still nursing right now with my son, Max, who's 2.5. And for some people that sounds so radical because, they have never thought about a baby nursing that long. And for others, they're like, oh yeah, that seems normal. And so, coming into becoming a mother, I hadn't really thought about how long I would nurse for. I did hear about things called child-led weaning and attachment parenting. And as I, read more as well as thought about what is my instinct here, a lot of it made more sense to me. And so I think as we step into more holistic way of doing things, that's where we really connect within and start to look at like what feels instinctual. So, in my case, from my experience, it felt instinctual to sleep with my babies. And it also felt like survival on some level. If I was going to nurse, that was one of the best ways for both baby and mom to have rest and get some sleep. And so the concept of putting baby in a separate room seemed like I wouldn't sleep because I would want it to be near them. Again, I know not all moms feel that way, and this is not to shame or judge anyone. I'm just telling my thought process. And so I think when you connect into your own body and your own experience and your babies, you'll be able to make some of those decisions of what works best for my family at this point in time. And that's constantly evolving. So when we think about the nursing relationship to begin with, I think one of the things that I think solidified nursing in a positive light for me and that I was going to be able to do it was really having someone that had been there before, had helped others nursed successfully, as well as had nursed babies herself successfully. And I could lean on her for advice. And so my midwife was that person for me. And, I remember having Jack and feeling like, what am I doing? How do I hold this baby? Is his nose in the right place? Is his mouth in the right place? What do I do with, my breasts, who are like so different than what I'm used to, because the milk's coming in and they're leaking and all these things that you just don't know until you get into it. And she was just like this voice of reason, very calm, but it was like, your body is capable of this. Your baby's going to latch and it's going to be okay. And just having that strong energy around me that you could do this was so important. I think so many moms don't have that. They either don't have someone in their inner circle who has nursed, and had a successful nursing relationship, or maybe they don't have someone who's confidently leading them in that direction. And so I think if you're someone who thinks that you will want to nurse your baby, that's just as important as having someone doula you through the birth process. It's important to have someone doula you through, especially the first month of nursing, because that is the most challenging time. Your body's really changing. The baby is so little. It's, especially if you've never nursed before, it can feel really awkward and your body hurts sometimes. Your nipples may hurt. So really having someone that can help you, and don't be ashamed, like have them watch you nurse and get your arms in the right position and help baby get in the right position. Especially depending on how much like breast tissue you have, that can be really helpful. So that I think is really key. And of course, as if I'm your chiropractor, I'm here to help you in any way I can, and will encourage you as well. Certainly know that your body's going through a lot of change those first couple of weeks, and your breast tissue and what's happening as far as like the milk coming in and leaking and whatnot, that can feel really overwhelming. And so, just like you take things day by day, moment by moment, that's a period where I think just remembering to breathe and ask for the support that you need whenever possible is really important. Making sure that you have adequate nutrition and fluids and rest, if possible, also is going to make this easier so that you're not quite so as exhausted. Now, I know sometimes that's not possible. And some people have a really more fluid time with it. And then there's others who are really going to struggle at first. Either baby's not latching well, or their milk didn't come in when they thought. And I think another message that we don't hear enough is that just because the first few days or even first week or two don't go well, doesn't mean that your body still isn't capable. So I think that's the really amazing part, is that your body will make the quantity of milk based on how much like suckling is happening. So it's so important to keep baby trying to latch. If the baby's struggling latching, a lactation consultant, a chiropractic visit, like have some people look at some of the things that could be off, a tongue or lip tie. There's just things that may be able to be done to help you. And sometimes it's as simple as, having the baby worked on chiropractically and making sure that we're in the right position and we're holding loosely. And also mom's stress level does matter a lot. So when you can remember to relax a bit, even if it's just in how you're holding baby, in the tension in your arms, and get more comfortable, that can make a big difference. So that beginning period, I think that's where a lot of people feel like they can't do it, and they may stop at that point. And I'm here to tell you that if you can keep going, it seems like each day you go longer is kind of like a win in the direction of that you're going to be able to set up a relationship where you're able to continue doing this. Now, also some people will pump and then put that in a bottle for baby. Again, the baby's getting mom's breast milk then. So there's so many benefits to that. A piece of advice that was given to me, depending on, again, what your body's doing, was that, while you have time off from work and you are like 24/7 with this baby, is to let baby just nurse and not try and pump and not try and intervene in the process, because your body will learn to make the correct amount of milk for what your baby needs, because all the inputs coming are from your baby suckling. And so again, this is just like mind blowing to me how beautiful our bodies are at doing what needs to be done, as long as things are healthy. And so like, that was my experience, is that with both Jack and Max, I just let baby nurse all the time. And then as I went back to work, then obviously I had to pump some when I was at work, but I still tried not to over pump essentially. So I was never someone that had a ton of milk saved up. I know some people made a lot more milk than I do. Again, it just depends on probably what you need with your working situation and your baby, and also how much milk your body some people make a lot more than others. I think also something that was helpful for me is I did not get too in my head about where baby should be on the growth charts. I knew that I was producing milk because I could feel it. Also knew that my baby was draining my breast tissue as they were nursing. And so my midwife, I think, did a good job of just helping kind of say, like, each child is different, each mother is different. And as long as we know that baby is getting milk and growing at their pace, like, and they seem like they're satiated after they eat, we're doing a good job. And so I think, again, we get so in our heads sometimes about, am I doing this right? Is my baby getting enough? All this that can really start a spiral of stress that kind of works against us. So I just want to put a plug in there again to that. Find those people who you trust, that want the healthiest for you and baby, but then are also going to help create space for you to not feel stressed out. So if you don't resonate with a provider, find a different one if possible. If you need to, find a lactation consultant or a chiropractor or a woman that's in your circle that can help you through this process, it's really helpful to have someone that you can look to and be like, am I okay? Is my baby okay? Yes, you're doing a great job, or let's try this. That's so important. And so another plug for just trying to get through those first month or two is then it becomes like, I think, a lot easier than even preparing formula, because you never have to really worry about where your baby's going to eat, because as long as they're with you, the meals are on demand. And so we've traveled a lot as a family, and I brought my kids to a lot of seminars, because during those first year or two, like, it's pretty easy to jump on a plane with them, and the meals are right there. So you just have to keep, paying attention to your own diet, getting enough fats in your diet, mom, and then also, making sure you're getting enough fluids. And that was a big one for me, is to just really elevate my fluids, which is good for me because I needed to do that anyways. So with that said, if I was just kind of giving an overarching theme of things that helped me, was number one, finding my person or a couple people that I could really lean on to help support me and ask the questions and say, oh my gosh, this really hurts, or I have mastitis, I think, what are some of the things I can do naturally to help this? And then, follow that advice. And also know that your job, especially in those first a couple months, especially, is to nurse that baby. And so sometimes we think we're going to get all these other things done, maybe when we're on maternity leave, or, just in our head, and, baby comes and all of a sudden it's like, what am I doing morning, night, and in the middle? Nursing. And yet it's such a beautiful time. And I can't think of anything really like it, where you're just so enamored with this new life that you've brought in. And you also get to slow your roll and just snuggle. And so if we can kind of relax into that, things will get done again. It's not going to be in this phase of life forever, but it certainly is a pause. And the more I think that you can just let your baby nurse, the more your body is going to innately be connected, where it knows how much milk to make. And, if you are having issues where your, breast tissue is really sore, because maybe there is some inflammation or like infection there, like, what I've noticed for myself is my tissue would do that anytime I wasn't around my baby long enough to like fully drain the breast. And so it's just like nature's way of saying it's time to nurse, right? It's time to nurse. And so if we can start to see some of these things as indications of whether we're, in the balance we need to be, or we need to figure out how to change that rhythm up or pump a different time at work or something like that. It's such an exercise in listening to your body, paying attention to your baby system, and knowing that this is a very special time in life that can feel really long at times, because there can be very interrupted sleep, and your body is not just your own body at this time. It's it's also feeding someone. But it's also really beautiful. So I'm here for anyone that, wants to talk about trying to set up a great relationship with breastfeeding and maybe doing extended breastfeeding, also just researching extended breastfeeding and attachment parenting. I would highly recommend. And child-led weaning is really how we weaned eventually. So, it was like, is he ready? Am I ready? Like by the time they're, 2.5, they're speaking pretty well. You can start to have some of these conversations with them about like, this is my body. So I know I'm going through that right now with my 2.5-year-old, where sometimes he'll want to nurse and I don't want to. And so, then I can say like, this is mama's body and we're going to wait to nurse till we're sitting, here. And then there's other times where it's like, it works for me. I'm not someone that I feel like, again, in our country, I like to embrace the idea of like, we go out to eat to dinner. So if we happen to be out in public and we're with our child, it's okay to nurse, right? And I think that's becoming more and more normal too. But this is all part of kind of making what is natural okay. And it's okay to be the nursing mom, nursing a toddler in the coffee shop. At least from my perspective, it is. So anyways, here for anyone that would like to have more dialogue on this. And I just wanted to, from my own perspective of someone who over the last decade has had a lot of time nursing, I would love, to help support anyone that I can with that too. It's a beautiful thing and it's beautiful for both of you and it's healthy for both your bodies. So thanks. You can find me at Cook Chiropractic in Chippewa Falls.